And we are back with you with Christine Brannick, the Oncology Outreach Manager with Cone Health Cancer Center. All right, we're talking about screenings, we're talking about mammograms. Can you contact the imaging center where you want to get your mammogram done directly, or do you have to go through your primary care physician?
You can go to conehealth.com/mammogram, and it lists all the Cone Health imaging centers, the contact information. There's even an option to schedule online, and that even lists all the sites for our mobile mammogram unit, which travels all over in our 4 counties of Guilford, Alamance, Rockingham, and Randolph County.
Yeah, the mobile mammogram, so in case maybe you are not able to get out, it can come to you, or at least closer to you.
You can, yeah, and the appointments only take a few minutes.
Okay. All right. So in addition to getting a yearly screening mammogram, there are signs or changes that a breast could be changing and showing signs of cancer, and that you need to talk to your healthcare provider about those kinds of changes. So let's talk about what are those changes.
Some of those symptoms are things like if you notice a lump or thickening in your breast or in the underarm area, any changes in the nipples, including discharge, spontaneous discharge, especially if it's bloody or clear. If you notice the nipple pointing inwards that normally points outwards, because it could be the sign of a tumor, tugging on that nipple, pulling it inwards. Any changes in the skin, such as any redness, scaling either of the breast or the nipple area. If you notice any change in size or shape of your breast, such as one breast getting larger or changing, it is normal as we gain and lose weight that the breast can get larger or smaller, but if we notice one breast changing, those are all things to report to your doctor. Also pain, and we look at pain, we look at focal pain, and that is pain that we feel with 2 fingers or less. Typically pain that is all over, that's typically benign. But it is, again, important to talk to your doctor about those symptoms.
Yeah, and I think a lot of times we're like, oh, I'll get it checked out eventually. But when you start seeing something like that, you need to talk now.
Especially if it's something different that's not normal for you.
Yeah, okay. Now, what happens if you just don't have a primary care provider and you're concerned, about maybe the cost of the mammogram and going to see all the different doctors and things of that nature?
So at Cone Health, we do have a mammogram scholarship program, and that is for women that do have a physician that they've seen within the past year that are uninsured. It's just for screening mammograms. So if you are interested in that, you can actually go online at conehealth.com and you can type in mammogram scholarship to get an application. We also have the BSEP program, which is the breast and cervical cancer control program. And that's for women, again, that are uninsured or underinsured. And through that program, they come and see us. They get a breast exam, pap smear, pelvic exam, and it covers their mammogram and follow-up. If we diagnose a breast cancer or cervical cancer to that program, those patients are eligible for Medicaid to pay for their treatment. And those patients don't need to have a primary care doctor.
Okay, gotcha. And so are there different options available at Cone Health when it comes to the different kinds of screenings?
They are all, the mammogram scholarship is just a screening mammogram. Now, BSEP, in addition to screening mammograms, would also cover diagnostic mammograms and breast ultrasounds. And those are typically the first tests that are recommended for women that have a symptom such as I had mentioned earlier.
Okay. Now, in addition to getting yearly screening mammograms, contacting your provider, are there steps that women can take that help reduce the risk of breast cancer?
It's important for women to obviously eat a healthy diet, to maintain a healthy weight, increase physical activity, decrease alcohol intake. It is known that women that drink 2 to 3 glasses of alcohol per day are at an increased risk of breast cancer.
Okay, that is good to know that it's not just your genes and things of that nature, that you do have some control over that, and it is your diet. Let's go over one more time about the guidelines of when we should start getting our mammograms and then how often.
So women should begin getting their mammograms at age 40 every year.
Every year. And so do you ever get too old to get a mammogram?
That's important to have a conversation with your doctor at what time is best for you to stop having mammograms, or if there is a time you stop.
Okay. All right. That is going to do it for us. We want to make sure that you have all of these resources, though, so that you can go back and listen and then say, okay, this is what I need to do, and this is how I need to do it. So if you missed any of this, it's going to be on our website, WFMInews2.com. It's in your To Your Wellbeing section.